All right, well, we are 1 minute past the hour, so we're going to go ahead and get started. I want to thank everybody for joining and good afternoon. My name is Brent Michael, and I'm the president of Isalis Healthcare, and we are the creators of the UroChoice Urology Information System that many of the practices that are a part of LUGPA are currently utilizing. We're sponsoring today's presentation on improving the patient experience, mainly for office-based and surgical-based practice environment, again, much like a lot of you guys. Isalis and UroChoice is a true all-in-one solution for today's modern practice, and it includes our award-winning EHR, our comprehensive patient engagement suite, a complete practice management solution with an integrated payment offering, and also includes RCM services for those practices that wish to outsource the billing and collection side of their practice. In addition, we've got a care management team that acts as an extension of your practice to manage chronic care management, remote patient monitoring services, which help improve patient outcomes at the same time while increasing revenue for the practice. Today, I'm pleased to introduce to you Mr. Matt Jensen, who I have known for years now and I'm proud to call a friend. Hopefully, Matt, you feel the same way. But Matt is a very talented CEO of the Vance Thompson Vision Centers with locations throughout the Midwestern United States. Matt will talk about those in a few minutes, but I think it's up to 8 or 9 practices now. And he's also the founder of MJM Marketing. Having visited the practice multiple times, the experience you get as a patient when you walk into one of the Vance Thompson Vision Centers is one you just have to see to believe, and is one of the reasons why patients literally come from all over the world to have their refractive eye surgeries done at Vance Thompson Vision. Matt's a national columnist and a speaker on the experience design, and I'm sure you will enjoy the speaking and storytelling style that is Matt. So, Matt, welcome to the premium group of urology practice administrators and clinicians, and the virtual floor is yours, my friend.
Thank you, Brent, and thanks everybody for joining today. The next hour hopefully is going to be encouraging and uplifting to you, and most importantly, hopefully it'll be something where you can tactically apply some of the learnings that we've had and made mistakes on over the last 20 years and improve upon them for your own practice. Brent, I am proud to say that you're my friend, and we've worked together across a number of companies now over the past decade, and we're very pleased that Isalis and UroChoice would be sponsors of such an important topic as the customer experience in healthcare today. We've got a lot to talk about because what we want to do is give you a level set on what's going on in the healthcare world, whether it's ophthalmology, urology, cardiology, or orthopedics. It's a big conversation what's going on in the healthcare world today, not to mention where the patient customer is in light of all that. And so as we embark upon this conversation, I'm just going to challenge you, though we are virtual, I just want you to lay your pencils down, lay your pens down. You've got other screens up, just try to pull them just for 40 minutes, pull the other screens down, and let's just have a conversation about the state of our world today, especially as it relates to our craft. Now, like Brent said, I work at Vance Thompson Vision. Vance Thompson Vision boasts, 30 doctors now and 8 or 9 locations. Brent, I'm glad you said 8 or 9 because I was going to say 8 or 9. It's just that one of us should know the right answer. and we're growing fast. 4 years ago, we had 1 practice, and now we have 313 employees across the regions that you see here. We used to say Midwest, now we say Mid and Mountain West, and we're growing faster than we know what to do with, and it's why it's so important that we have partnerships with people like Brent on the software side of things, who can help us stay on pace with the growing expectations of our patient customers and our teams. Okay, we're going to talk about the patient experience today, but we're going to also talk about the team experience in healthcare, and that's going to be the underpinnings of our talk today. Here's the big bullet. Here's the big thesis. Healthcare today, the headline of the talk today is healthcare is 21% of GDP, 21 cents of every dollar. is spent on healthcare in some regards. That's out of your household, my household, businesses spend, all of the individuals who live on the planet or in the United States spend 21 cents of every dollar in a healthcare related offering. And that's a ton. That's up from 17% just a few years ago, 2015. And it's growing and growing even more. And it's because of the rising costs in healthcare. It's because of declining reimbursement. It's because of the things that we're buying in stores that are healthcare related, and because we're fascinated about our own health and well-being. Meanwhile, what we also know is we're not sure we're better for it. We're not necessarily healthier for it, and we want to know why. So today we're going to do that by talking about just a few details. Now, it's not meant to be a lecture. I'm not going to shout at you. I'm not going to give you any things by way of barking across the screen here, but I do hope to kind of share a brain with you, that when we share stories of things we've done wrong and share stories of what we can do better, share stories about what we think we are doing that's particularly good, that you can just shamelessly steal. We can share a brain, you can make up for our mistakes and get better at it on your own. And that's our goal from today. Now, when we talk about things like experience design or the customer experience or the team experience, the elephant in the room is a big one. It's, I've heard people talk about team experience. I've heard people talk about team initiatives. How are we going to pay attention to the customers? Every time I hear about this, it costs money. How much is this going to cost me to implement some of the tactics that you're about to go into? And that's where I'm just going to ask you to just take a look, have a view of the end in mind as we're going through the hurdle of understanding what we're talking through. Just keep a long view of what we're hoping to keep your eye on the long term, not necessarily what we do tomorrow as it pertains to our conversations today. Okay, so let's just start from the top. I'm going to tell a story about a family event that happened in my life in the mid-90s. My wife, who is the daughter of a journalist and a school teacher, through a big national piece of national work that my father-in-law did, she and her sister found their way to the Halekulani in Hawaii, an all expense paid trip by the company that my father-in-law worked for at the time. Now, this is one of the nicest hotels in all of the islands, and in the mid-90s, a hotel room at the Halekulani cost $389. That was the price that was on the back of the door of the Halekulani Hotel. Now, people get variable rates, and they got variable rates back then, but $389 today would be a lot of money for a hotel room. 25 years ago, that was scraping the ceiling of the highest cost hotel rooms around. And so for a working family, this was an experience like they had never had before. They went all over and toured the island. After their work was complete, after a couple of days, they were invited to stay for a few days. And in doing so, they explored the island, and they all four of them descended on their hotel room that evening and decided what they were going to do for dinner that evening. And they said, hey, let's just go back down to the hotel room or to the hotel restaurant that has an amazing dinner, and we'll do that for our dinner tonight. Well, my wife's younger sister wasn't feeling awesome. They're both in college at this time, and decides to stay up in her room, and the three others go down to dinner. And later on, the younger sister gets hungry and decides to order room service. And the person on the other line of the room service says, you should really try, if you're not sure what you're going to have, you should try our chicken salad sandwich. It's famous. We have a lot of people who love it. And so she did. She enjoyed the sandwich. She ate all of it except the crust, because she's kind of a picky eater. And the family comes back up and they talk about what great dinner they had. And she said, I got hungry and I had the sandwich. And then they make plans for the next day. Now they're exploring the island again the next day, and they all descend back on the hotel the next night, and they decide to go downtown for dinner. Sister-in-law is still not feeling great, so she stays back, and the three go downtown for dinner. And she calls down to room service and she says, you know, that sandwich is so good, I'm just going to order that same thing. But this time, when it comes to her room, it doesn't look like that. It looks like this. This is the sandwich she receives on the second night. And the question that you should be thinking of is, why in the world would they do that? How did they know how to do that? And what kind of impression were they trying to make with Colleen, my sister-in-law? Well, they did it because she left the crust on her plate the night before. So let's just go kind of backstage. And here's what it looks like. Okay. Colleen, who's picky, she doesn't eat her crust. She puts it on the plate, takes the plate, puts it on the tray, takes the tray, places it in the hallway. Sometime that evening or the next morning, there's a busser. We're talking somebody from 14 to 20 years old. I was a busser in high school and college at a nice hotel. And so you imagine somebody kind of running up and down the hallway every couple of hours to pick up trays and make sure that the hallway doesn't smell like buffalo wings. Okay. And takes this tray back down to the kitchen. Okay. Hands the tray then off to the dish room. Dish room people take a look at the tray. They scrape the plate, scrape the tray, put it in the dishwasher, put everything back in. So now that detail, that artifact, that piece of information has gone through two sets of hands. Now, somebody, you should be thinking, along the way had to take a look at that plate, probably the 16-year-old, look at it and say, there's something here that can give me insight about room 717. Okay, looking at every detail, like how can this inform my next interaction with them? How can I look at this not as a dirty tray, but as customer intelligence, secret intelligence, right? That we will use to make the interactions with them stronger in the future. And so as that busser is dropping off the tray, or as the dishwasher is cleaning the tray, somebody is taking that information and doing what? Entering it somewhere, placing it somewhere. Or if it's old school, leaving a note somewhere for someone. Hey, in case room 717, hey, room 717 doesn't need crust. Hey, whatever, some kind of no look pass to someone, so that 3 shifts later, a morning shift, a lunch shift, and an evening shift, when that room calls again and it's the same guest, they know to approach that guest differently with the sandwich, right? Now, it doesn't cost anything more to cut the crust off of bread. It doesn't. But it does cost something. It's an investment of time and energy and treasure to get a busser and a dishwasher to talk to another server or whoever's going to take that call, the next night's chef. I mean, the information goes through 3 or 4 people to come out the other end and deliver an experience that's such a wow to room 717 that 25 years later, the thing that that family remembers most about Hawaii isn't the island, isn't the climate, isn't the waterfalls, but a chicken salad sandwich at a $400 hotel. Now, whether it's urology or cardiology or ophthalmology, $400 is like the baseline fee. I mean, you can trip over a bunch of things that cost $400 on your way to care in our offices, but we don't pay attention to customers like this. We don't use our systems to capture customer intelligence. Yet in our world, we have more secret information like that than any other category of business on the planet, right? We've got DNA, we've got blood types, we've got borrowing ability, Social Security, emergency contacts, Social Security. Oftentimes, I mean, we have history of past family. We have all kinds of other disease states that we capture. We've got birthdays, all the things, right? And we use this much of it to make sure that the patient customer knows that we can customize the care for them to wow them at the point of care. So that's our introduction. Okay, that's the backdrop. Somebody who charges $500 over here for something is going to give somebody a 10 times better experience than we can give for $5,000. That's unacceptable, gang. We can't have that in healthcare. For as much as we spend in it, it should be the best experience people have ever on planet Earth And instead, it's the worst, except for maybe the airlines. And there was a couple months there where I thought the airlines were going to kind of like edge it out because they were just grateful to have people back on the planes. And now it's the worst again. But I mean, healthcare is like right there. It's not super great. I wouldn't brag about how much better it is for a customer than the airline industry. I mean, we make people wait hours. We don't call them till the day before on when their surgery is. We leave out information. We bludgeon them with information. They don't understand how the financials work. They are left to navigate it on their own. Okay, so that's the backdrop. Here's the agenda. Our consumers in healthcare, they've changed. Consumers everywhere have changed. People now, item 2, are interested in investing in experiences, not things. They're willing to remember experiences, not things. Companies who can create experiences, not things, will win the day. And then 3, the best way to do this, the best way to have an immersive experience that your company, your patients, your team raves about is only through the team. As managers and leaders and executive suite folks, as doctors, we can't get there from here. Right? We are too busy in the rooms doing the work. The experience has to be set up by people who are adjacent to the work, all of our support staff, which frankly, as leaders, we don't do a good job of setting them up for success. We create barriers for them to do the right thing at the point of care. So that's our agenda today, 1, 2, and 3. So let's talk about how our consumers have changed. How is the market changing? Well, we pay a lot of attention to books like this. Some of you might be from Ohio. My friend John DeJulius has written several books on the topic of the customer experience. He runs a salon and spa and now a consulting firm out of the Ohio area. And his work applies so readily to healthcare, even though it's not healthcare, because it's a high dollar amount, because people wait a long time for the offering, and because of his team's desire to get that secret intelligence way before the customer shows up on site, okay? And so we've stolen a lot of information from the salon and spa world. We steal all the time from that category. We steal all the time from the hotel and hospitality categories. Why? Well, because if you steal from another category, you're an innovator. If you steal from a competitor, you're a thief. Right? But if you steal from another category, if we steal how to, treat our teams or treat our patients from Nike, it's like, wow, that is so innovative in healthcare. But so we're encouraging you through this talk today, cheat, go look at other businesses, figure out how to emulate the things that they're doing in your work. What John DeJulius asserts in his book, Secret Service, is that we have 1/20th the human interactions that we had just 20 years ago. Now, interestingly enough, that was a quote from the book Secret Service over here on the left. Secret Service was actually published in the mid to late 90s. So he said in the late 90s that we have 1/20th the human interactions that we had just 20 years ago in the 70s. You think human interactions have gone up or down since the late 90s? With the augment of the cell phone, in the 2000s, and the iPhone in 2011, and all of the variations since, human interactions at an all-time low. We know this, and we see this in our businesses, right? Remember when we used to go to a Barnes and Noble and wait in line for a new release of a book, or to have some book author sign it? I mean, now we can go online. We can not only get the book a week before it's released to everybody else, we can even pay more to have it be a signed copy, right? We can order that from the airport. We can. There's no lines for that anymore. This used to be how we learned, right? Now we learned, especially in the last couple of years, most of that learning we can do online. It's going to be subpar. But it's not going to be as immersive as it is with in-class learning, but it can be done. We've proven that. One of the fastest, most profitable parts of education is online learning for the university. So we take the same professors that are teaching at your local college or university, right, who are probably underpaid, And not only can they do that by day, but by night, they can find an online university to teach, get a little money on the side. You don't think that's profitable? No brick and mortar. So profitable that the football stadium in Phoenix is named after Phoenix University, or was at least. All cash, no overhead. This is what we used to do to go to movies. Actually, there's been a strange resurgence in this in the last year or so, but you know how families have taken on the movie world since. We don't go to movies like this anymore. We stay in our homes. I remember when I was an early adopter of Netflix and I had to subscribe, right? I had, you get 3 DVDs a month and they'd come to your mailbox. And I'm like, I'm not walking all the way out to my mailbox. I'm going to get it delivered right to my television. I don't have to go outside. I don't have to speak to anybody as long as I live. This used to be how we banked. There used to be a line of people ready to do things at a teller. I've purchased several homes and moved a lot lately in the last few years. Never once entered a bank to do so. Brand new bank opened in one of our markets, nice new place downtown, and was getting a tour, and they had this great vaulted interior area with the teller line set up, and they had this like velvet roped off section, where they with a queue, and I looked at it and I was like, what is this about? I was like, oh, that's for the line. I'm like, are you expecting like a crowd to come to your bank? Nobody does that. Nobody's going to the bank to cash in their check anymore. We take a photo of it. We upload it. We do all of our mobile banking through our phones now, and it's probably more secure than walking up to a teller. So we have 1/20th the human interactions. We could sit here and go through 30 more ways that we have less human interactions than ever, and we know them to be true. What that also means is that we have people then who are coming to us who have much higher need for social interaction. Okay, we know that loneliness as an all-time high. So this is a statistic as of 2016. AARP put out a study that said in the past 20 years, loneliness has doubled amongst seniors from 20 to 40. 2 out of every 5 people 65 plus. Legitimate loneliness, legitimate categorical diagnosable depression related to just their social interactions, their social environment. That's the statistic that's already 7 years old. I think it's more or less now with social media. By the way, the fastest group to be joining Facebook today is seniors 65 plus. Meanwhile, youngsters are fleeing, Instagram as fast as possible and running actually away from Snapchat and towards TikTok. The fast, youth runs to a new platform. Seniors, older people tend to go there a little bit later. Youngsters are continually trying to find new mediums to be able to hide from their parents and communicate. My generation, it was MTV, right? Then it was emails. Then it was, Facebook and the others, and so on and so forth. But so even though seniors are connected social media wise, loneliness is up. How can that be? Well, because they're seeing things, they're seeing the lives of others' interactions, and they know cognitively it's not true, but they're still living their lives comparing to others with fewer human interactions than ever. A new form of depression being categorized, though it's by a business magazine, it's talked about all the time in the mental health world of devisolation. Under the illusion of being social, we're focused onto our blue screens, and we are becoming worse and worse off all the time, even though we know it's fake. So we have 1/20th the human interactions we had just 20 years ago, probably even more so now that it's 40 years ago. And we are serving people, team, and patients who are absolutely starved for meaningful interactions. They're starved. So much is riding on the interactions that you have with your patients every single day. So much is riding on the interactions you have with your team every single day. There's a patient who came from 3 hours away little town called Mobridge, South Dakota. It's more like 6 hours away. And it was a few years ago. And I remember her coming in and saying, 3 days ago, I was at my bridge club and they wanted me to tell them what this new building was like, because our building, has special lights on it. And it was the talk of the town for a while. And they said, they want to know what this building is like and what the new Costco is like, right? And the next time she was going to see those folks is the next week. Whereas before, a generation earlier, she was probably living a far busier life, but there's going to be, 6.5 full days between her interaction with them, her visit with us, and then her interaction with them again. And we might be the only meaningful interaction between she and them 3 days later. Now, I hope that our team treats her better than Costco will, but I'm not confident. Costco's pretty awesome. They're pretty awesome at training. We better be, because we're charging, your office and mine, we're charging 10, 15, 20 times more. Why can't we treat them better? Especially when we know she's coming and we know that this week happens to be maybe her birthday, and we can pay attention to that and customize it and, and make her life, make her events worth talking about. So that's how consumers have changed. Okay, we are serving people who are starved for meaningful interactions, and not just our patients, our teams as well. Okay, now let's talk about what people want to spend their hard-earned dollars on. And we're going to go through this part pretty quickly. Okay, so there's another book author that we're huge fans of. Jim Gilmore and Joe Pine wrote a book called The Experience Economy. For those of you who are paying attention, Brent and Maggie will have these slides. You're free to have them. And since I told you to put down your pencils and you haven't been writing down all these books, you should know what those books are. These are great reading for you as leaders. They're great reading for your team. Here's the premise of the experience economy. It's the underpinnings, the backbone of understanding what we mean by experience design. But here's the thesis. Work is theater. Every business a stage. Now, I'm not going to put Brent on the spot by asking him what kind of verb is from his English days, because I know he's got a doctorate in English and literature. But I'll just come out and tell you it's simile. Okay, I mean, it's not simile. It's a literal verb. Simile would be work is as theater, or work is theater-like, right? Or ly. Work is theaterly. That's lame. That's probably the lamest joke I'm going to say on this meeting. That's not what it is. It's work is theater. It's literal. So, do we believe that's true? Do we believe that work is theater? I mean, what happens if I come into your office tomorrow and everybody's in jogging pants and polo shirts? Well, that's a different wardrobe. That's a different costume. That's a different kind of setting than healthcare would normally. When I walk into your office, I'm probably expecting to see some scrubs. Maybe the business office types are in suits. Maybe the doctors are in white coats. Maybe not. They're at least dressed nice, right? That's theater. There's certain roles we play. There's certain lines we deliver. There's certain blocking that we do, like we would on a dress rehearsal. There's certain wardrobe that we use for uniform than we would on a Saturday morning. Saturday morning, if you see me, I'm definitely not wearing a sport coat with a killer pocket square. That's not what I'm doing. I'm all vegged out. I'm in a totally different uniform for my family, right? Because it's all snuggles. And so that's what we mean by work is theater. There's things that we'll say at work, we just won't say at home. And it should be that way. But if we really look like it's theater, if we really believe that it's theater, then we and all of our places are at best doing improv. Like we're kind of making it up as we go along. And all I'm saying is the best businesses in healthcare, the best healthcare organizations, they don't do that. The best shows aren't improv shows. I mean, there's Whose Line Is It Anyway, but even that we could go into a big debate as to whether or not it's truly improv. It's not. It's street theater, which is not all the possibilities, but a limited number of possibilities. And everybody knows kind of where Drew Carey will go versus other people, and they'll all have 10 or 12 options, and it comes off like it's improv. While it's just a limited number of finite choices with the illusion of infinity. Okay? But the best shows, Hamilton, Miss Saigon, whatever. They all, Les Mis, they all have this long, linear, planned production. Well, that's the way it should be in healthcare. It's not like we're surprised. We're not surprised with what the first interaction is going to be with the patient, or what the second one is, or what the doctor's going to ask. Now, patients will present differently, and there's some nuance and all that, and I get that. But we definitely know the flow of scenes that are coming at us, and that's what this book taught us.
Matt, are you going to give some examples of what you mean by some of these?
I will. Yep. I'm glad you asked, Brent, because those are right after these examples here. This model here. This is really the thesis underneath experience design, that people would prefer experiences more than things, and there's all kinds of great data to suggest it. All this is to show that as dollars and cents go from left to right over time, time is this way, dollars or this way, that over time we've become an economy in the West that are willing to spend more on things that are experiential. If left to our own devices, we will talk about, adhere to, be loyal to things that are experiential more than things that are just transactional or goods or services that you drop on your foot. So here's an example right off the bat. Okay. So the progression of economic value would say that if you wanted to buy enough coffee to make a cup of coffee at the Chicago Board of Trade as a commodity, it would cost you 1 to 2 cents. If you wanted to buy enough coffee to make a cup of coffee from a grocer, it'd be from, Folgers or whatever, it would cost you 19 to 21 cents. A service would be at your local Perkins or Denny's or whatever. A bottomless cup of coffee is going to cost you $1.19. And then we all know the experiential version of that in our own minds. $4 to $8 is Starbucks. And there's a whole different language, a whole different subset, a whole different, some of the places will remember you and have your coffee ready, all kinds of customization. That's what we mean by the progression of economic value. And it's been validated in several magazines since 2008 with a down economy as ideas that are reshaping how our economics work in this country. And a lot of the companies that are now shared economy companies, a la Uber, Airbnb, et cetera, are built on these assumptions and premises. So let's give you an example of one right off the bat. Right, Airbnb, I didn't check it this morning on what its worth is, but they were offered to be bought for $20 billion just a few years ago. They decided to stay on their own. Meanwhile, Hilton Properties is also worth $20 billion, but they're also completely leveraged by debt and real estate. Well, Airbnb is a completely customized business that not only sells space now, you can go rent space anywhere, but they've added this element on top of it where you can go customize your experience while you're in town. So not just stay at a place by the Golden Gate Bridge in San Francisco, but also, go night running on the Marin Headlands, glow sticks, good beats, plenty of big views. Join us for this Airbnb experience, right? So not just a place that happens to not be used, right? It's taking all the inventory in the world and using it or allowing it to be rented, but also then experiences that are close by. Now, again, the backdrop is to show you just companies that are doing this well with customization with very, very little customer intelligence. Yet once you've stayed at an Airbnb or gone through an Airbnb experience, they've got you nailed. They'll slowly get, you'll be marketed to, or when you go there, they'll give you options that are more like you every single time. Okay, so how can we learn more about that with our own healthcare experience? Well, here's how we've applied it to our own practice, Brent. Here's example number 1. Lisa works in our phone team. Lisa's been with us for 12 years. She's a great member of our team, great at booking appointments and great at helping people understand their needs for helping explain the technology that could be used in cataract surgery, for example. One gentleman calls in a couple of Novembers ago and he says, "Hey, I'd like to come in for my cataract post-operative exam." And she says, "Great, how does, looks like November 17th, we've got an opening for that." Does that work for you? And he says, oh yeah, that November 17th, I think that that works okay. Oh, no, I'm sorry, that doesn't work very well. Is there anything else that works that week? She said, well, we've got the 18th open available as well at 10 a.m. Does that work better? He said, no, it's just that on the 17th, it's just, it's my wife and my anniversary. It doesn't work the best. She said, great, well, let's do that 18th. He said, actually, it'd probably be good if I do come down to Sioux Falls. He was from an hour away. I could see some friends. Oh, okay, good. Let's do the 17th, the 10 a.m. work on that day. Well, it's just that she passed away this summer. And so I just, probably be good for me to see some of my friends down there on that day. And it catches Lisa cold. She said, listen, we can also just do it another day. It's no worries for us. I said, no, let's just keep it the 17th. I'll come down. I'll see you guys, and then I'll see some of my buddies in Sioux Falls. She says, oh, okay, and she gets the information plugged in, and she hangs up the phone after saying that we'll see you on the 17th. And she turns around and she does what every phone person would do, your practice in mind. She said, oh, she's had the saddest conversation with this man who confessed to me that his wife passed away. And her team, they feel it and they talk about it for a minute, but then she goes on and does something that not everybody would do everywhere. And she contacts the front desk. She contacts the clinic team that they're going to see. She puts notes in his chart through our customizable forms so that when he checks in, there's instructions there that he should be whisked right back, taken back to a room. She's there waiting. Other team members are there waiting from the front as well. And not only is she there to wish him a happy anniversary, but she's there to wish him a happy 40th wedding anniversary, because she went online and she looked up the obit. She found that it's not just any anniversary, it's a special one. And they all gave him a $19.50 cookie cake that looks like this. And she didn't ask me. She didn't ask anybody. She just went and did it because she thought out of the goodness of her heart that would be the right thing to do. And I absolutely love that experience for that team member. So what Lisa knows is that she can spend up to $100 in cash at any moment in time to blow the minds of her customers, her colleagues, or a vendor, okay, to make the experience just unforgettable. And so she doesn't have to go get approval from anybody to do that. And it's not like she spends $100 a day. She doesn't. This was $19, and she, filled out a form, and we reimbursed her on the next paycheck, and it was no big deal. But we want everybody on the team to act the way that we as leaders and doctors would act anyway, and to follow their natural impulse to do right. And we also want to have the underpinnings of what they had at the Holly Kalani Hotel, where if they want, they can share notes with one another in such a way where an experience can be customized without having to do a bunch of arduous work. And all she gets is to be celebrated in this thing. And the question comes, do you think she's a pretty good employee? Somebody who does this? Yeah, she's a great employee. You think she's good to work next to if you're in the cubicle next to her? Yeah, I'll bet she's pretty awesome. I'll bet she doesn't forget your birthday, right? I'll bet she brings donuts every once in a while, and it's a good experience to work next to her. So these principles apply to businesses very well, especially in healthcare. So the first is our consumers have changed. The second is that people are interested in experiences more than things. And those two are just a plea. Okay, they're a plea for you to pay attention to this third category, which is the tactical side of what do we mean or how do we apply these things to our team. And that's where we have to have a team mindset. Now, Harvard Business Press put together an article a few years back that said that if you hire people, you want to hire people who have the highest amount of skill and the highest amount of attitude, right? And we want people way up here. And we want to refrain from hiring people who are in the bottom right. And we want to be very cautious about hiring people who have high skill and high attitude. We'd hire them second to last, and we'd ideally hire people who are high in attitude and a little bit lower in skill first. Everybody get the model? Hopefully that makes sense. Well, the trick is we already have 313 people. So how do we make sure that we get the right people in on the team in the first place? And that's where we just have to work really hard at two things: people who have a lower skill but high attitude, and people who have a lower attitude but higher skill. We have to look at them much differently. One, we have to train. Skills are easy to train, right? Those are yes or no things. We can check them off if people aren't doing a diagnostic right, or filling out a record right, or taking the right information. That's training. Coaching, that's harder. That's Brent pulling me aside and saying, hey, that comment you made in that meeting, I think it was, what did you mean by that? I may have come off differently than you hoped. Say, well, this is what I meant by that. Yeah, I don't think that's how people caught it, right? That's coaching, harder. And we don't train people to be good coaches well. It's a difficult skill to learn. But we feel like we can do it more and more by just being around each other more and more often. And that's why we have the backdrop in our organization of the team that plays together, stays together. This is just a couple of years ago. We had what we have at every site, for every site every year, a 12 months of Christmas where we get together virtually or otherwise to just talk about these principles, practice these principles, get to know one another. We want everybody in our office to have a bestie at work. We also study for training purposes. We have studied this book called The Physician Success Secrets. And in that book, they talk about how 50 to 80% of the information that's provided by the clinic at the point of care is instantly forgotten. Of the balance, it's information, only 50% of that is remembered correctly. So for those of you who are, paying attention from home and keeping the math, that means 25% of what we say at the point of care, at best, 25% is going to be remembered correctly. Okay. Well, what does that mean for us? Well, it means we've got to be really careful about what information we give where. And Brent, this is the money slide right here of how we break this down. So if everybody in your organization knows what happens at each of these stages of the process, things have a fighting chance of going well. What the Holly Kalani Hotel knew is that the person who is going and getting the tray is supposed to report back on anything that's amiss on that tray. Now we know what that general flow is for our own practices as well. Ours actually has 13 steps, but we'll dumb it down to 8 for this, because all of our practices, whether it's urology or ophthalmology, have these steps. There's the initial phone call or referral. There's pre-visit, the days leading up to their actual visit in your office, where we're going to send them literature or emails with information. There's how we greet them at the front. There's a kind of testing or workup with your nurses or technicians before they reach the doctor. This is the time with the doctor down here under consult. By the way, that's what patients think they're coming to you for, even though they've already had these other steps ahead of time, right, where things could have gone wrong. Come in for your 9 o'clock appointment. Well, I checked in at the greeting and now it's 9:30 and I still haven't seen the doctor. Well, we never expected to see you before 9:30. Right? Because we had all this testing to do. Whereas way back in the phone call, if we could have staged that properly, we would have said, listen, you're going to come in for your 9 o'clock appointment. There's a little bit of paperwork to do, about 20 minutes of testing with one of our nurses, some question and answer time with you, and then you'll be ready to see our provider, probably around 9:20 or 9:30. I just let you know that because then there's some scheduling afterwards that you'll need to do. But if you're looking to get to another appointment across town or another event, you probably aren't going to want to schedule that before 11 o'clock. Your whole visit will probably be 90 minutes or so. Well, that's far more information and far better experience, predictable than just saying, hey, your appointment's at 9 o'clock. Then there's the scheduling part after you see the doctor or coordinating. Then there's the departing. What do we say then? And then what happens after the exam between then and when they come back in the next time or come back in for surgery. So this is what we call the customer experience cycle, and it's what we train on. It's what we everybody needs to know in the process. And so that's from the phone team on to they're pulling up to our building, their check-in process at our front desk, same flow, right? Everything should be really intuitive to how you check into the process. We want them to experience certain things along the way, that are memorable. And we feel like if we can incorporate those things and have them be muscle memory within the practice, then we can have ways that we can hardwire different ways to remember them at the point of care. So in this particular case, that we would look at our front atrium not as a waiting room, but we could denote in the files in our system where folks are sitting, so we can come up and greet them properly, not like any other healthcare institution where we're yelling from the hallway. It can all be customized where they're sitting, front and center, brown sleeve jacket, black peacoat, so we can greet them as properly. So those are the ways that we handle some of the tactical things at the point of care, Brent, within our practice. Okay, team, so this is what we mean by things, getting your team involved in all of these steps of the process. And I know I've blown through that last category, these last eight sections very quickly on the customer experience cycle, and how that, by knowing that from a scripting standpoint, how everybody in your team can know that, so things can be entered in the file and we can treat team members in a custom fashion along the way. I now want to hand it back over to you, Brent, to just see if there's any questions and from the audience, or what questions that you've generated since you've been listening here, buddy.
Yeah, I want to bring to the end kind of what you said a minute ago. And when you walk in a Vance Thompson site, there's a marquee, and whether you're a vendor or a family member or otherwise, there's a welcome sign with your name on it. You're greeted with a smile, not with somebody's face in a computer because they're finishing something up. And it's a mindset. The gift of sight, that's a whole nother thing. But the smell of popcorn, the smell of cookies disarms people, makes them feel just a little bit more comfortable in an environment where they're scared. Instead of somebody screaming to come back, you feel a touch on the shoulder and saying, "Hey, Mr. Michael, it's time for you to come back. How you doing today?" And you walk into the exam room and somebody's creeped on my social media and they know the type of music that I like that's just magically playing accidentally on purpose. There's lots of examples like that Matt can go into that really makes the difference in an experience. And that's what we should all be focusing on more, less of being like a traditional healthcare practice and more being an experience for consumers. And that will drive more business than any of us can imagine. And as a healthcare IT vendor, I'm the leper of the world here, but we're driving the same kind of thing. It doesn't matter how good our software is. If my client experience is not a good one, it really doesn't matter. And so we're kind of all in the same boat together. So I don't know if we had any questions that were brought upon, but Matt, I greatly appreciate the time that you've taken today out of your busy schedule to hopefully give some tidbits that people can steal and utilize in their practices going forward. If there are any questions after the fact, feel free to send an email either to myself, Alan Winkler. I think you've got my contact information, and so anybody that forwards to you, we can certainly pass that along. And greatly appreciate everybody taking time out of their days. And once again, Matt, thank you very much, my friend.
Thanks, Brent, and thanks everybody for your patience and for paying attention today. This is how you can reach me should you have more questions directly too. This has been a 20-year-long journey. And we are in no way done. We're just better at covering up our warts than anybody else, but we're happy to share because we think that if we can improve the way people do healthcare, it can be really meaningful for the good of the whole. And we need folks like our sponsors today to help us with the underpinnings to do just that. So thanks, Brent and Maggie, for helping set this up.
Thanks all.
Thank you.